Tēnā tātou katoa, good evening. Remember what life was like before the COVID restrictions? Now, after more than 2 years, we're just about there again. Today, the government decided to ditch the traffic light framework altogether from midnight tonight, with just a few rules left. Masks will no longer be required in retail and on public transport. They'll only be required in high-risk health settings, like in hospitals and at the GPs. Vaccine mandates are gone now too. It's now entirely up to employers if they want to enforce one. And this is why today just 1,149 new community cases were reported. Compare that to the peak of the outbreak in early March, which saw more than 23,000 cases. Political reporter Amelia Wade has the details.
The end of an era. COVID's traffic lights not just turning green, but turned off altogether.
This is the time when finally, rather than feeling that COVID dictates what happens to us, our lives and our future, we take control back.
Actually, 927 days into the pandemic, it's the government relinquishing its control. Lockdowns, masks, vaccine mandates and COVID frameworks, which New Zealand's had in some form since March 2020.
The most significant restrictions on New Zealanders' movements in modern history.
All the COVID arsenal almost all gone by midnight.
Now is the time to move forward without the extraordinary measures we have previously used, and with the certainty that we have all missed.
As much as we want COVID to be over, COVID still is around. People are still dying from COVID, and it's still quite a serious infection around the world.
The infectious diseases expert asks, instead, why not just give green a go?
I'm just a little bit afraid that if we remove the whole system, then it'll be hard to re-establish the system.
We shelved the alert level system when it was right to. It's right to shelve the traffic light system now too.
Just a few rules remain. Masks are still mandatory at hospitals, GPs, urgent care pharmacies, aged residential care and disability-related residential care. And COVID cases still have to isolate for 7 days from when you start showing symptoms. But household contacts no longer have to stay home too.
I think the amount of infection we have at the moment is probably good that we drop it a wee bit.
I do think that they're good, but I also think that they're redundant at the same time.
Mask scraps for pubs, planes, buses, supermarkets and shopping.
We do not want to ask more of you than the evidence tells us we should.
2/3 of customers on a national level aren't wearing masks. They're ignoring the rules or claiming to be exempt. So the rules really are a bit of a nonsense.
I'm sure some people will be concerned about the removal of restrictions. They'll see it as the removal of protections.
I want to reassure those Kiwis that we are making these changes because risks are lower.
The opposition says the rules should have been tossed out ages ago.
Good news that it's happened. We've been calling for it for some time, but frankly, Kiwis have moved on.
And so, with COVID waning and its severity easing, it's time to move from the COVID new normal back to the old normal.
About bloody time.
Happy to see it go. Goodbye, COVID.
Do you have any final departing words for our friends, the COVID restrictions?
They were probably more frenemies. You know, they did the job we needed.
See ya, COVID restrictions. You've been a time.
Amelia joins us now. Kia ora, Amelia. Is this the end of the COVID response?
Well, Mike, this is essentially the day that COVID becomes a managed virus. A deadly super spreadable virus, yes, but with expanded access to antivirals, cases down and spring here, the government simply cannot justify those extraordinary limits. The legal framework underpinning the restrictions remains just in case there's a new variant or a new wave which requires a ramp up. But after almost 300 days into a pandemic, people are clearly done, and the government clearly quite wants to turn the page on COVID and all of that hatred that came with it.
Amelia, imihiana, ki a koe.